doing well in this wonderful festive season. But I want to talk to you a little bit more about breathing. But this time, I want to talk to you about how it impacts your core work. So, are you progressing through your core work, but finding that your abs don't seem to be getting stronger? Your diastasis doesn't seem to be getting better? Well, that is what we're going to be talking about today. Hello, I am Katrina and I am a pregnancy and postpartum corrective exercise specialist, and I work with mums who have diastasis to help them move without pain, stop peeing their pants, and generally have more confidence in their bodies again. So, last time when I did my 8-week challenge, which by the way is starting again in January, so make sure you're on the wait list, I had a lady who was like, I'm doing planks, I am doing past the advanced core work, I've worked with PTs, I never feel it in my abs. Like, I never feel like I'm getting stronger, but I can hold a plank for 2 minutes and I don't feel a thing. But why is my diastasis not getting better, and why is my core not getting stronger? So I stopped her and I said, let's have a look at it. Let's see you do a plank. Let's see you do some heel slides. And I spotted it straight away. Her breathing was stopping the abs from working and causing her back to do all the work. And no wonder she was saying, I have such back pain. Well, yeah, because every time you go to use your core, or the front of your core, you're using your back. So we adjusted her alignment, we adjusted her breathing, and guess what? She started feeling her abs whilst she was doing heel slides. You know that one that you all tell me, I don't know what this is doing. Like, why am I heeling slides? Like, why can't I do crunches? Why can't I do planks? Right? She started feeling her core when she got her alignment and breathing right with heel slides. Remember, she could do a plank for over 2 minutes without feeling it. But when we got it right, she was feeling it with heel slides. Okay, so let's get into how we can fix this. So remember last week we talked about belly breathing and 360-degree breathing. So belly breathing was when it all comes out to the belly, and that puts a lot of pressure on our diastasis, so we don't want that to happen. But occasionally we may need it if we need to release our pelvic floor. Then we worked on that 360 breathing. So that's when the ribs go out to the side, our belly expands, and our back expands. Right? So we get this great expansion, and that's what we want. Then we touched on what happens when our back comes into play. So what happens is our breathing goes like this. So can you see how it's all up in my chest and my back is arching? Doesn't have to be much, look. Now, that means that my back is doing the work with my breathing. Now imagine that you are doing that when you're trying to connect with your core, or the front of your core, your abs, right? So our ribs are meant to be stacked over our pelvis and our back backwards and forwards, so it's nice and relaxed. Now, if we have flared ribs, or if we breathe like this up into our chest, what happens is our ribs come out of alignment, our core opens and flops about, and our back does all the work. This tightens our back. It causes an anterior pelvic tilt over time. It tightens your psoas, so the long hip flexor muscle, and it means your abs are doing no work all day. Doesn't matter what you are doing, your back is doing the work. Your abs are just hanging out on holiday. Now, holiday is great if we're sitting on the beach, but not during the day when we are lifting our kids, reaching for things, doing the washing. We need those abs to fire. So let's have a little bit of a check on how we can make sure our back isn't doing the work. So, I bet you guessed number one. Number one is get back expansion with your breathing. So look, here's the difference. No back expansion and chest work. Back expansion. Right? Now, when you get that back expansion, do you know what happens? It releases your back, so it's no longer tight. It drops your diaphragm, which releases your psoas, so they're no longer tight. Remember those people who said, my hip flexors are tight and I've got an anterior tilt and no matter what I do, I can't get my hip flexors to release? Yep, back expansion for you. So tip one, get back expansion. If you don't know how, the foundational program has many exercises to help you get back expansion with your breathing and teaches you exactly how to do it. All right, so tip number two is our alignment. So let's come down and have a look at our alignment when we are doing things like heel slides, TVA engagements, knee lifts. Now, here's my brow line. So the bottom of my rib cage, that should be on the ground. Now our lower back should have a little bit of a gap because we have a natural curve there. You don't want to force that into the ground because otherwise you're upsetting your spine, you're compressing it, and you're going to have issues with that. So we don't want this arch here. See how now I can put my whole hand under here? We don't want that. We want our ribs stacked, but we don't want to grip them down because otherwise we have those issues with our pelvic floor. So we need to align ourselves. So for some people, it means bringing the pelvis down and ever so slightly pulling it up from the pubic bone. But remember, we want that little bit of a gap down there. So we're not forcing it down and tipping our pelvis under. We're just releasing it and pulling up slightly to get that rib cage, bottom of the rib cage down. And that's what we need because look, when the rib cage is not down, my ribs are flared, belly open. When the rib cage is down, nice and flat and connected between my hip bones and my rib cage here. Okay, so that's number one. What happens if you can't do it? You might be like, I can't get those down. Don't worry, grab yourself something to boost up your head and maybe just under your shoulders, okay? So for some people, they're so tight around the thoracic region, they can't actually get their rib cage down. So you might want to start by boosting up your head and shoulders slightly to just help you get that alignment right, especially when you're working your TVAs and heel slides, okay? No issues with doing that. And as you get stronger, more back expansion with your breathing, then you'll be able to come back down. So that's tip number one. Then we want to make sure our back doesn't do our work. So let's just say I'm going to go and do knee lifts. So I'm going to engage and then work my knee lifts. Now can you see how my back doesn't come off the ground? Okay? Now what happens if, on the other hand, I engage and when I engage, my back fires? Well, now it's off the ground, and when I do my knee lifts, sure, I can still do them, but my core isn't doing any of the work. My back is, okay? So we want to put your hand under your back, inhale into the hand, exhale, engage. Now work the knee lifts without the back coming away from your hand. It should stay squishy. Your back is not holding you up. The floor is. So there is no reason for your back muscles to be firing at all. So they should stay squishy whilst doing your knee lifts. And the bottom of the rib cage should stay on the ground. The lower part shouldn't come off and it shouldn't squish into the ground because that tends to cause the bulging and bearing down. Okay? So remember, nice neutral, relaxed back, and our knee lifts are really easy and our breathing is all into the back. All right, so I want you to check that out and post below what happens when you do your back. And if you change it so that the bottom of the rib cage actually comes down onto the ground and you put your hand under it and it stays squishy, do you feel it in your core more? Because you know what happens? You need to stabilize your pelvis from the top. So from your abs versus from your back. And you are going to feel it so much more than if you don't. Quick one, because I talked about planks, what was wrong with her plank? Let's have a look. When we do a plank, so whether it is on the wall, on the chair, from your knees, or a full plank, you also need your back to be out of it. So if you're doing a plank position, so we come into it and we work into our plank position, but you've got this little bit of an arch there, then your ribs are flared. So our ribs are flared and our core is open, and it doesn't, I could stay here for hours. It's not hurting my core at all, but you know what it is hurting? It's hurting my back. I'm going to get lots of back pain doing that. Now, also, some people are like, oh, well, that's okay. I will fix that by rounding my back. Okay, I rounded my back, but I didn't fix the tilt. All I did was gripped down with my ribs, rounded my shoulders, kept my arch. Now I've got this double whammy of my core not doing anything, but I'm bearing down on my pelvic floor and my mid-TVAs. So that's not going to be working for me. So let's go into what we do need to do. We need to push away from the ground, but not bring our shoulders to our ears. And then we need to come into our plank position, squeeze our glutes. Can you see how when I squeeze my glutes, it rounds my lower back just slightly? Okay, so now my lower back is out of it. I had to pull up from my lower TVAs by pulling up a little bit from that pubic bone and engaging there. And now when I breathe, you can't breathe. Right, that's not much good. So what we want to do is we have to breathe into, you got it, into our back. And we have to hold that position. And that, my friends, is so much harder than holding it with the anterior tilt and your back doing the work. That poor back needs to have a break. So give it one. All right, so let's just take a quick note of what we've gone over today. One, we need to get the breathing out of our back doing the work. So this sort of rocking motion, right? So that chest breathing, because that's tightening our back. We don't want that. That causes an anterior pelvic tilt, causes tight psoas, it causes your back pain, causes lack of thoracic rotation, it causes just so much, it causes flared ribs. We don't want that. So what do we want? We want back expansion. So we need to work back expansion. Right? If you don't know how to do that, foundational program has lots of exercises to help you out with that. Then when we think about doing our core work so that our back is out of it, we need to think about our alignment. Are we stacking our ribs over our pelvis and on the ground? That means that the bottom of your rib cage should be on the ground, but the lower part of your lumbar spine here should not be. You should be able to just slip your hand under there. Then that back needs to stay squishy throughout the whole exercise. It doesn't need to hold you up. It doesn't need to fire, okay? So keep your hand under there. Make sure it maintains squishiness. If you can't get your rib cage down, grab something to put your head and shoulders up a little bit just to help you get that down until you've worked on your back expansion, because you need back expansion, otherwise you're going to get back pain. And then lastly, remember, whatever position you're in, whether it's a plank position, whether you're standing, you need to think about this. That stacking, making sure the back is as relaxed as it needs to be, depending on the movement. If you're standing, your back is holding you up, therefore it's going to be firing. But it doesn't need to overfire, tighten, and let the core go. Alright, well I hope this was really helpful for you. I can't wait to see or hear what you found when you tested out your breathing with your core work, tried to get the back out of it. Let me know. Also, this will be the last live I'll be doing for 2019, so I will be seeing you in 2020. But until then, I hope you all have a wonderful, wonderful Christmas and holiday season with your family. Don't forget, my 8-week challenge starts again in January. Make sure you're on the wait list. There will be some extra surprises between Christmas and New Year's. Then we'll be doing our blueprint between New Year's and the first sort of week. And then we'll be into the 8-week challenge. I hope to see you there and have a wonderful rest of your day.